Previously on the Osasu show, we sat with Nigeria's Honorable Minister of Health, Professor Isaac Adewale, to discuss the increasing rate in child and maternal mortality. We also paid a visit to Garki Hospital, where we discussed with pediatricians and gynecologists on the way Nigeria can curb this increasing trend. Later on in this episode, we visited an internally displaced persons camp in Area 1 Abuja, where we spoke with displaced women who were unable to afford adequate antenatal care. Take a look. Is there any such thing as free healthcare in Nigeria?
We pretend to be doing that, but it's just all pretense, maybe for political reasons.
Why is it that in the 21st century, Nigeria doesn't have affordable and quality healthcare for the poor?
Well, it's quite a challenging thing for us as a nation. But being on this seat, I would not want to look too much to the past. Because when you look too much into the past, you are not going to make much progress. But as a new administration that is people-oriented, that is deeply committed to developing pro-poor programs, we will redress the injustice of the past.
Why I had the opportunity to go to just was because of you, because of the business you gave to my husband. That was why I was able to afford the hospital bill. That was why others didn't have the opportunity I had.
On today's episode of the Osasu show, we sit with the World Health Organization's country representative to educate us on its partnership with Nigeria's Federal Ministry of Health. Dr. Rui Gamavaz, WHO representative for Nigeria, welcome to today's program.
Thank you very much.
You're welcome. Sir, WHO assisted the federal government of Nigeria to achieve Guinea worm certification, and in 2014, WHO helped in containing the Ebola virus. Most recently, Nigeria was removed from the list of polio-endemic countries. What other diseases can we look to the WHO for and the Federal Ministry of Health to help, number one, either contain or, number two, eradicate?
Well, first of all, thank you for coming to WHO. As you know, WHO have the country cooperation strategy. The country cooperation strategy, which we have here, it goes up to 2019. In this country cooperation strategy, we define what are our priorities with the government of Nigeria. It's not WHO that comes today and define we are going to work on A, B, C, and D. No. This country cooperation strategy defines the main priorities, and every 2 years we have our biennial work plan. When we, together with the Federal Minister of Health, we define what activities we are going to jointly perform in that year, in 2 years' time. And therefore, we define how much we are going to allocate for each biennial. Okay. So this is a joint activity. So whatever is been done by WHO is based on what we together, the country and the WHO, define that are critical areas that requires specific technical systems. As you know, WHO, we are not a funding agency. We are mainly a technical agency that provides the technical support when it's needed. So in terms of the question that you raised, let me concentrate first in terms of achievements. The first one, that the most recent that you have already raised, is the interruption of polio transmission in this country. So this is a remarkable milestone. In the next 10 days, we are going to reach 20 months for the first time in 18 years that we don't have any wild polio virus in this country. And this has been mainly achieved because of the government leadership. That is very clear. It's not WHO. WHO is a technical agency that provides the technical support. It's the country leadership that has been able, particularly the involvement of the state governments, to take the lead to ensure that all the activities were fully implemented. Allocation of resources has been also critical. And this has been not only the role of the government of Nigeria that put a lot of resources, not only financial resources, but human resources and other infrastructure that were required in terms of the cold chain, in terms of the transport, in terms of the media involvement of communities. And this brings also to me to the attention the role of the local religious and traditional leaders. Without the support from the traditional and religious leaders, it will be impossible to reach the communities. And that has been an important best practice for Nigeria and for the African region entirely, how it was possible to be done. And I'm pleased that all the religious leaders and traditional leaders were fully involved since the beginning. And the number of non-compliance for vaccination, which was a big issue in this country at the beginning, went almost to zero. We have a few cases, but it's not relevant. Another important matter is the cross-border activities. You know, there is a lot of population movement from Nigeria to other countries, to Chad, to Cameroon, to Benin and Niger. So the cross-border activities with the neighboring countries, particularly with the involvement of the LGA's chairman in those districts that are bordering with other countries, it was also critical to ensure that when population was movement from one side to another one, they were vaccinated. So this is one of the examples of the very good best practice. Another one, as you mentioned, it was the EVD, the Ebola outbreak. When it reached Nigeria, particularly Lagos, with a huge population between 25 to 30 million inhabitants, we thought it would be a humanitarian disaster. But in 3 months after, we declared the containment of Ebola in this country. It was a remarkable milestone for all of us, and we are proud what has been achieved. Again, this was due to fully involvement of the government of Nigeria since the first day. An involvement of the state governor in Lagos and in rivers, when it also affects the rivers. So this is another example that shows when there is the political commitment, when resources are allocated on time, when the community is fully aware, and when all the traditional religious leaders, that part of the community, they are fully involved, we can very easily reach and achieve our goals. You mentioned about guinea worm. Of course, guinea worm is another example. It's an example how we have been using the polio infrastructure to tackle other epidemics. And guinea worm was one example. Ebola was another example. We used all the infrastructure that were available in those states, in those LGAs, to go house to house. Of course, we had other public health interventions like availability of water, sensitization, and active surveillance, house to house surveillance, to identify any potential guinea worm case. So these are some of examples. We have also recently an outbreak of cholera in Maiduguri. Again, it was used the Emergency Operations Center that we are using for polio to reach the population. It was a huge epidemic, but again, we are trying, and this is what we are doing as part of the polio legacy, how to use the available infrastructure to strengthen health systems. And this I'm very glad that the Honorable Minister of Health and the new administration, they are putting the primary health care at the foundation to strengthen health systems in this country. So unless we have the facilities available, unless we have facilities with a very good trained, skilled and competent staff and motivated staff, with adequate supplies and commodities, it's very difficult for us to ensure that we improve the health indicators in any country, and in Nigeria in particular. So this is what has been done. We are very pleased that we are part of this, the process. One of the critical areas that, as part of WHO responsibility, as part of strengthening health systems, is strength laboratory capacity. without a very good laboratory capacity, it's very difficult to identify any potential outbreak in the rapid response. Another area is maternal mortality. Nigeria has one of the highest maternal mortality in the African region and in the world. So this is another intervention that we are working together, not only in formulating policies, strategies and guidelines, but also in terms of capacity building, in terms of establishing emergency obstetric centers for immediate rapid response when it's needed, in terms of sensitization of population. I just came from Sokoto from the National Health Council, and 94% of the deliverers are at home. 94% of the deliverers are at home. So those are the issues that we need to tackle in terms of the cultural aspects, in terms of the beliefs, in terms of investing in education. This is critical, not only for maternal mortality reduction, but also for any other type of health interventions.
Definitely. And you're talking about WHO providing technical support. So in states like Sokoto and most of the northern states where we see an epidemic of, child and maternal mortality, which of some of the symptoms are malnutrition and lack of antenatal care. So what technical support or what systems can the WHO look to create in collaboration of the federal government to make easy access information, make accessible information to community level health workers? We need a database, a system that would ensure that we can check, health workers at the community level. So what technical support can WHO provide or assist the federal government to come up with?
Well, I think it's important to highlight that our role is not replace of government responsibility.
Definitely.
So our role is based on the needs, specific needs per state or at the federal level. We provide the necessary technical system. The government have their own infrastructure at the ground level. So one of example is polio. What we are doing, we have our search capacity and we have our staff, even at the LGA level, providing support in terms of the micro plan. It means identification, the number of children per house, ensure that vaccines are available, and to ensure necessary logistical support to vaccinate these children. Identify if there is, after the vaccination, if there is any child that has been missed, what areas that has been missed, and then to ensure that with the government leadership, we go into continue to vaccinate those areas. Surveillance is our also responsibility to ensure that we identify, and we have indicators, to ensure that any case of paralysis is identified. And then we need to check if this case is a polio case or any other disease that brings paralysis to the child. These are examples that we are doing at community level. Engagement with the local and traditional leaders is also we have been advocating. We have staff in all 36 plus 1 state. In all, we have sub-offices. And our colleagues are working very close with the state ministers of health. And when you speak about Emergency Operations Center, that has been a best practice in this country, we are working together under one roof. Not everybody coming with one plan, no. Our role is to ensure also among partners that we come with one voice and we provide one support based on the country priorities.
That's amazing. That answers my question about the database, WHO building a database that's available, well, in collaboration with the government, that would really help tackle issues at the community level. A database filled with community health workers that are available, data and statistics, because one of our major issues in this country is correct data, data accountability, which we're really lacking. And I'm glad WHO is able to work hand in hand with the federal government to provide those statistics that would help in eradicating and containing such diseases. So lastly, Dr. Rio, what other technical support does WHO have in plan 2016? I know we're talking about a 5-year plan, 2014 to 2019, but for 2016 specifically, what technical support can we look at WHO and the federal government to collaborate on to improve the well-being of Nigerians?
Well, the main one that we are continue putting efforts is in polio eradication. We need till July 2017 to ensure that we don't have any case. We need 3 years since has been interrupted transmission without any case.
3 years?
3 years,
okay.
without any case. So we are going to reach now, by 24th of this month, 20 months without any case. So we need to ensure that we finish the job. But it doesn't mean that by 2017 we can relax. No, we need to continue many more years to sustain the gains. The number of children that are born every single day is tremendous in this country. And therefore we need to ensure that every child is vaccinated as part of the routine immunization. So this is one of our critical and priority areas. By the way, the largest amount of resources that we have, it is mainly associated with the immunization activities in Nigeria. The other important area is to strengthen health systems in general. And strengthen health systems means human resource for health. Without a very good technical capacity by the government at those facilities, it's very difficult to reach the population. It's very difficult to ensure a very good health care in this country, any country, and Nigeria in particular. This is why we have 2 main activities that we are, as an intervention, supported by the government of Canada in Cross River and in Bauchi. Strengthen human resource capacity and the human resource registry. We are creating a database in the government, Federal Ministry of Health, to understand what type of cadres do we have in this country. Okay. The staff, okay. The personnel. Okay. Where are they located? Where are the gaps? What the health needs to be done to overcome those challenges in terms of the gaps. This is in a critical area when you speak about health systems. Another important area that I mentioned that is under our work plan is strengthen laboratory capacity for rapid response to epidemics, to ensure that surveillance is fully operational. We have Lassa fever at the moment. We have an outbreak of measles. We have an outbreak of meningitis. Unless we have the capacity to rapidly respond to those epidemics with the support from a good lab system, it's very difficult to tackle. So this is another important area that is under the responsibility and under the core functions of WHO. Strengthen the laboratory capacity and surveillance. Another area that we are working is on TB, HIV, and malaria. You know, malaria is one of the major public health issues that we have in the African region and also in Nigeria. So, but a lot has been achieved so far. The number of reduction in terms of deaths associated to malaria has been decreased. So there is a lot of ongoing interventions, and our role is to continue to scale up those interventions. Not only to stay in the few states, but to ensure that we have a wide coverage, to ensure that we can reduce the morbidity and mortality associated with HIV, TB, and malaria. HIV, even though the estimated seroprevalence is 3%, Nigeria has one of the highest burden in terms of number of people that are under antiretrovirals. We need to ensure that these people that are antiretrovirals continue to take the antiretrovirals. We need to ensure that it's not only the medicines, but integrate them within the communities. Avoid stigmatization. It's still a big problem in this country. Definitely. So all of those issues, it's also our own responsibility. Of course, WHO are working with other partners. Neglected tropical diseases is an important area. Guinea worm is one of example. But we have leprosy, we have schistosomiasis, we have many others. We have a specific program under WHO with providing technical support to the Federal Ministry of Health to ensure that we tackle neglected tropical diseases. It's an important area. Essential medicines, you know, the counterfeit medicines is a big public health problem in Nigeria in particular. And this is why during the World Health Assemblies and our regional committees for WHO, Nigeria always provides some information, what's going on, what has been done. But this is an important matter that WHO, we are providing technical support to the Federal Ministry of Health to ensure that we provide a good quality control of medicines and to ensure that we prevent the counterfeit medicines. These are some of the areas, but we have many others that we are working together with the government of Nigeria.
Ai mga lami dan juma nga obe angwa tunga maje. Aboko jin yilo yito no ekwan kote ibebia yilo. So yito mboho yilo lo kuma no ekwan ile makoma man kuma abi balala ba nko ya. Kuma she yilo nla bniga ya tanu ekwan beje oje kwan ko we she na makata bidati ababal wala ga yito no ya. To ayan ye sai la e gwamnati kwa jin ga yin tuko tinu e boko yin mba ba ga iboho ija yin lo nu e ben.
Ai mga liatu Haruna anguan tingama je ayan ko jin ga ye fi no na sha ko yin da me ya gbaji titnin to kuma ayan aba ga ba no ma na helele tai ba jap malo ko yi titnin na sha ko ile na bai sha mai ya ya ba jap ma te ye no ma na ndam sha ko ko vula ya tela la ko vu te ko vu nga ba ko jinyi ya nga ye no ma na ye abe na pompo no ya ngwai isno wala le no ko ko te ba kamata yes no ko amai no ba te fle na ngwai isno ile so ye no wano ya ngwai ba tengama je gaube abe ite.
We are suffering a series of water in this our community because we don't have a pipe-bound water. The water we are using is a river water and the water is not good. It's very dirty. So the water, if we take the water, we are taking the dirty for ourselves because we don't have any other options. And our children are fell sick because of the water. The water is not good for us. We want the government to help us with a good water so that we can benefit the water and stay away from the sickness. That's what we want government to do for us.
Thank you, Dr. Gamavaz, and we hope you will exceed when next we call on you for an interview.
Certainly.
That's it for today's program of the Osasu Show. Don't forget to watch the full episode on our website, www.theosasushow.com. To read more on sustainable development and current affairs in Nigeria and Africa at large, you can also visit our website and check out our YouTube page. The details are below. For sponsorship and advertisement opportunities, you can call or email the details below as well. Don't forget to follow us on social media at The Osasu Show on Instagram, Facebook, and Twitter. I'll see you same time, same place next week, and until then, take very good care of yourself.